Hi everyone, so this is the continuation of my previous lecture. Now talk about the clinical features. In clinical features, it may develop so two type of symptoms. First of all, symptoms can be due to the gallbladder itself, like when the stone in the gallbladder it presents as a cholelithiasis and the patient present with pain in right hypochondrial region, or due to the obstruction of bile. Obstruction of bile means what? Obstructive jaundice. When the stone in the common bile duct, so they present as obstructive jaundice, and it can be acute or chronic. And patient present with abdominal pain, vomiting, nausea, and patient mostly complain that whenever I eat some fatty food, so I feel pain. Why? Because due to the vagal stimulation. Then there is a pain and biliary colic. So keep in mind, when the gallstone obstruct the cystic duct, so it becomes distended, inflamed, and immediately infected, and which present as an acute cholecystitis. So patient can develop fever. If fever, so it's a sign of acute cholecystitis, and that pain is radiating to the back and right shoulder region, and that is associated with nausea and vomiting. And patient when during inspiration patient feel pain. Why? Because distended fundus of gallbladders come in contact with abdominal wall in the region of right ninth and 10th costal cartilage. So when patient during inspiration, so inflamed gallbladder touches the abdominal wall and they cause pain. And then there is a jaundice. Jaundice in a patient usually occurs when there is an obstruction of common bile duct. When there is obstruction of common bile duct, what happens? Patient present has an obstructive jaundice. In that case, we will do what? ERCP. And patient mostly complain of itching. Why? Because bile is absorbed by the blood and give the skin and mucous membrane yellow color. So it's an irritant for the skin. So this is about the changes in the urine and stool color. So what happened? The excretion of bile pigment by the kidney which give a urine a very dark color, and for the feces normally it like the brown, but there is no bile, so feces is like a clay color feces. So when there is obstruction of bile flow, so when there is obstruction, so they will interfere with the absorption of fat soluble vitamin like A, D, E, K. When the K will be less, so there will be what? There will be disturbance of normal clotting profile. So patient can present as a bleeding. So bleeding chances will be more. Now I will talk about what are the investigation of choice which we will do in the cholelithiasis patient. So first of all we will do CBC, then hepatitis C, and then we will do liver function test just to check the liver profile, and then we will do ultrasound abdominal pelvis just to see what's the size, what's the caliber of liver and common bile duct. Then we will do X-ray chest and X-ray rectal abdominal pelvis to find out the other causes. This is the ultrasound. In ultrasound we will check the stone in the gallbladder, either it's more stone, multiple or single, so they will give us an idea. Then we will do what? Cholecystography, in which patient will inject some, patient will take some agent by mouth and they excrete it by the liver. So in the liver, when that material will be passed in the liver, so we will visualize the gallbladder through cholecystography. And this cholecystography is same like a IVU, intravenous urography, in which we will check the kidney as well, ureter and bladder. Now talk about the ERCP. Actually ERCP, we mostly visualize the structures of the biliary system. ERCP we used has a diagnostic purpose as well as therapeutic purpose, that in which, for example, if we suspecting the stone in the common bile duct, then we will do what? ERCP. In ERCP we will take out the stone from the common bile duct and then from the GIT tract. See, this is how we perform the ERCP. This ERCP tube go into the duodenum, and from the duodenum they pass into the papilla and then go into common bile duct, and they take out the stone from the common bile duct out from the GIT tract. This is how we perform the ERCP, and multiple images we will take. And we will also do what? Percutaneous transhepatic cholangiography. Cholangiography is related to the biliary system, in which we visualize the biliary system, either there is obstruction or not. See, there is some stricture, so PTC give us an idea about is there any abnormality in the biliary channels or not. And then this we perform under moderate sedation on a patient, and before ERCP we will do all the baseline investigation. We will do clotting profile, because during ERCP, so if there is some bleeding, so there must be some platelets present, but if there is no less platelet, we will not do a ERCP. So there are some protocols. Then we use broad spectrum antibiotic. So this is about cholelithiasis, about the third lecture. So in my next lecture I will continue this my cholelithiasis topic. Thank you.